Okay, we're about to be live on YouTube, so we can get started whenever everybody's ready, and you're ready, Anthony.
Okay, yeah, so we probably 1 minute. Aaron said that he had a challenge getting in.
Okay.
So he should be just a second.
I'll see if I can help with that too.
Okay.
Sometimes I wonder, do you really love me?
Earl.
Then I think of something sweet you once said to me.
It said, Dr. Alex G. He's listening in. Talking about the Duke Earl is awesome. A little bit before my day, but I have to listen to some sessions on a regular basis. So let's give about a minute. Go from here.
But then when I see so many of my buddies getting shot down all around me, it makes me kind of glad that we waited, because I don't want to leave you at home being a widow and all. I know you understand, baby. Listen, darling, they promised me a furlough on the 15th of next month, and I want you to say a prayer tonight that my furlough will come through so I can come home to be with you. And tomorrow, go by and tell my mom and daddy that I love them and for them not to worry about me. Listen.
Okay, Doc.
That I'm gonna make it. Tell everybody back home I believe that I'm gonna make it. And baby, I'll be home before you can say it.
All right. Okay. Thank you so much for everyone who may have joined on. We haven't started it yet. I think we are kind of still trying to allow people to log on in. All right. Thank you again for everyone for joining us today on our lunch and learn of emergency COVID and corrections and crisis. Today, we're going to really just kind of, have very straight to the point conversations and being able to really just kind of just navigate what is going on inside the corrections, and also kind of, debunk some of the myths that are out there, and we're hearing it directly from Secretary Carr and staff. Just really just looking forward, not to only having the conversation, but also being able to just talk together as a community, as we often do in our lunch and learns, and being able to hear other folks' input, and being able to, making sure that not only for this hour that we're having the straight to the point conversations, that we're continuing to work together as a community. Excuse me about that. So first, would like to introduce Secretary Carr. And basically just, Secretary Carr, hopefully, are you there?
Yes, I am.
Okay. Oh, awesome. There you go. Yeah, you weren't, I couldn't see you on my end. It's just, I guess one of the things I just want to say thank you so much for joining us today, for taking out the time of your busy schedule. I know you're dealing with a lot of things throughout the whole state. And I just want to just ask if you could just tell us more about yourself, describe your relationship with the criminal justice system, and we can kind of start off and go from there.
Okay, great. Can I ask a question first?
Yes, sir. You can ask me anything.
You want me to go into? Is this part of my 5 to 6 minutes?
Yes, sir. Yeah, there's
Okay.
a part of your 5 to 6 minutes. Yes, sir.
Oh, yeah, because I have a schedule and I wasn't supposed to go until after a couple of other people, but I'll go now. I'll
Okay.
just follow your lead, okay? Whatever,
Okay.
you're running the show, so whatever you tell us to do, we'll do.
All right, I appreciate that.
Yeah, no problem. Good afternoon. Or, yeah, it is afternoon. So thank you for inviting us here today. I'm glad to be here with you. And I want to thank Nehemiah for the invitation and the opportunity to speak and to listen to the group today. My name is Kevin Carr, and I'm the Secretary of the Department of Corrections. I began my career not necessarily in corrections, but in 1977, I started working with youth in Milwaukee County at the Milwaukee County Children's Home and the Child Adolescent Treatment Center with kids who had troubles at home and also had mental health conditions. And then in 1980, I joined the Milwaukee County Sheriff's Department, where I stayed for 30 years. And during that time, I worked in just about every division and held just about every rank except for sheriff. And when I left there, I was the second in command of the largest sheriff's office in the state. And during that time, I had spent 10 wonderful years as a detective, and 7 of those 10 years I worked undercover in narcotics enforcement. In 2010, I was fortunate to be appointed to the position of U.S. Marshal for the Eastern District of Wisconsin by President Barack Obama. And that I thought was the highlight of my law enforcement career. Quite frankly, in 2018, because it's a presidential appointment and the Trump administration had come in, I was going to be replaced, and I planned on retiring and joining my wife in retirement. I was really looking forward to it when in the winter of 2018, Governor Evers offered me the chance of a lifetime to have an impact on the community and to help people change their lives who are in custody by offering me the position of Secretary of the Department of Corrections. Only an opportunity like that had that opportunity to impact people's lives could lure me away from retirement. And I'm extremely happy that I made that choice. Okay. As you know, it's been a challenging year, and this pandemic has brought unprecedented challenges. And the last couple of months have been the most challenging. COVID-19 cases have surged in communities across our state and in our institutions. I'm sure many of you have noticed the rising positive test results among persons in our care this fall. And while our number of active cases just since Thanksgiving have recently dropped, thousands have tested positive over the course of the pandemic. And I want to stop there for a minute and just put that in perspective, because, if we have a cumulative test number of, let's say, 7,000 or 8,000 positive tests, those are tests that reflect just a percentage of our overall population, which quite honestly, I will tell you, when this pandemic started, was around 23,400. And I'm proud to say today that we have 3,000 less people in custody today. With that being said, many of the folks that did test positive remain asymptomatic, but some did become seriously ill. And as of today, it's difficult for me to say, but I have to say it, that 19 persons in our care have died from COVID-19. Now, I want you to know that it's no coincidence that we didn't have our first fatality until the fall of this year, when the number of cases statewide exploded. Our facilities are part of the communities in which they're located. And when this happens, whatever happens on the outside of our facilities eventually makes its way to the inside of our facilities. So, you know, we're part of the greater society and the communities where we are. And, you know, as those numbers statewide rose, our numbers internally rose at the same time. I want you to know that our agency has and will continue to strive to limit the spread of COVID-19 in our institutions and also care for those who become ill with the virus. That has been and will continue to be our priority until this virus no longer poses a threat. Now, we all know this is a very contagious virus. And while our response has included extraordinary measures to keep people safe, the research shows us that it's difficult to control the virus in institutional settings. We continue to act proactively and listen to the public health experts. Decisions this administration has made have been guided by the CDC, the Wisconsin Department of Health Services, our Bureau of Health Services in DOC, and healthcare professionals at our institutions. Now, the impact of the pandemic on DOC institutions has been profound, and it's put a great strain on our staff and the persons in our care. I believe that it's important for us to note that many of the individuals throughout the state, the steps that our agency have taken have gone too far. For example, some people think we've gone too far by suspending in-person visitations and limiting group activities, postponing work release, instituting mass testing, and we severely limited movement during outbreaks in certain facilities. People think that that's way too far, but a lot of people think we haven't gone far enough. All of this feedback is something that's important to our agency, and we do listen. I mean, sometimes it may feel like we don't, because just because we don't do what people want us to do or say that we should do, doesn't mean that we didn't hear them and consider their input.
Secretary Carr.
Yes, I'm just sorry, about done.
Okay, no, go ahead.
All right. Now, while we may not see eye to eye on all aspects of those responses, we all share a common goal. The health and safety of those in the care of the Wisconsin Department of Corrections is our goal, and I'm sure it's your mutual goal to keep people safe. I hope this common goal will help us work together during this difficult time to keep people safe. And thank you for your time.
Thank you for all of that as well. Because this is the only reason. Yeah, well, just want to just make sure. I want to ask all of our panelists one of the additional questions as far as. So I want to go to Makta. I said it right. Hopefully I said it correctly. If you don't mind, if you could just tell us more about yourself and describe your relationship with the criminal justice system. If we can probably keep it, 2 or 3 minutes or whatnot, that'd be great.
Sure. So my name is Makta Pasahaya. I am very grateful for all of you for inviting Secretary Carr and I to this event. We are really appreciative of the opportunity to connect with the community and connect with Nehemiah and the work that you all do. Our goal today is that, or we hope that we are going to be able to provide you more clarity in the response that we've had at the prisons throughout the state, and hopefully answer some questions that community members have. A little bit about me. I know that a biography was sent around, but a little bit about me is I'm from Milwaukee. I'm a Milwaukee native. I've been with the Department of Corrections for the last 6 years. I am a lawyer by training, but Secretary Carr invited me to join his team in January of 2019 to serve as the administrator for the Division of Adult Institutions. Meaning in my role, I'm responsible for the oversight of the 36 adult prisons in Wisconsin. And as Secretary Carr stated, we have just a little over 20,000 persons in our care. And we also employ about 7,200 staff in my division. Secretary Carr alluded to this, and I just want to reiterate it. Our goal throughout this entire pandemic has been to try to keep COVID-19 out of our institutions and trying to mitigate the spread of the virus at our facilities. We have again been working with CDC, Department of Health Services, and our internal healthcare professionals to try to mitigate the spread of COVID-19 in the facilities. As you all know, this has been a worldwide pandemic that has spread rapidly, and we are doing the best that we can with the information that we have under the circumstances in which we're in to try to address this pandemic. So just very briefly to go over some of the things that we have done in response to the pandemic. We have been regularly cleaning and sanitizing the institutions, cells, and educating both our staff and persons in our care on how to better care for themselves during the pandemic. We also have healthcare professionals at our sites that are caring for persons in our care with more persons in our care at this point in time have more access to healthcare than the community has right now in the world, as there has been a decrease in the ability to get clinic and hospital visits due to the pandemic. We've provided masks and required masks for both persons in our care and our staff. And we are continuously providing additional PPE to our staff and to the persons in our care. As a result of the pandemic, we've also reduced the amount of intakes from county jails. We've expanded our earned release programming so that we can get more people out and released into the community. We have exhausted every option that we have as a department to try to release people based on what is allowable by law. And we are always isolating and quarantining persons in our care that have either been exposed to COVID-19 or have tested positive or have been symptomatic. We're regularly testing persons in our care and our staff for COVID-19. And we're working again with agencies like the CDC, Department of Health Services, our own Bureau of Health Services, and other organizations to ensure that we have all of the information that we need to appropriately address COVID-19 in a congregate setting.
Thank you.
So, yes, thank you.
Oh, I'm sorry. Yeah, thank you so much. Naomi, if you don't mind just telling us a little bit about yourself and if you can describe your relationship with the criminal justice system.
Absolutely. And of course, first, thank you so much for having me. And we're really, grateful for the opportunity to partner with Nehemiah and kind of talking about these issues. A little bit about myself. I come from Central Wisconsin. I've been an investigative reporter there, focused on criminal justice issues of various types for almost the last 2 years. I'm coming into the Madison media market. I'm fairly new to this market. I came in a few weeks before the general election. And that was right around when, as Secretary Carr alluded to, just kind of that rise in cases in the prison system and also the jail system. Just as we saw that rise statewide, as he mentioned, we also saw that rise within the institutions inside those communities. And so one of the issues I was tasked with coming into the station, coming in as their investigative reporter, starting this type of, enhancing these types of coverage, was focusing on some of these COVID-19 issues among our jail systems and again, among our state prison system. And I do want to recognize for a minute also the fantastic work of others like Emily, who's been in this market for longer, covering this issue for longer as well. So back to, I know that one of the things that was mentioned in kind of talking about what we would talk about today is kind of the personal and professional perspective of how COVID-19 has impacted inmates in these facilities. And to recap a little bit of a couple of the issues I've been covering over these past couple of months. Obviously that, that spike in cases, some of the deaths that have occurred as a result, but one thing that we really honed in on as a station was New Lisbon. And the reason for that was just partly because of the location. It was one of the institutions that's located in the Channel 3000 viewing area. And also it was briefly a site of one of the larger outbreaks. It's now no longer, I know there's other outbreaks that have been larger, but part of that was location. It was a site of a bad outbreak. And I guess the other part of it was just the sheer volume of messages we were getting from inmates in the facility, from loved ones of inmates. And one of the roles of media when covering these types of issues is making sure that we're amplifying the voices of people who may not otherwise be amplified. And one of those groups that can be very often are incarcerated populations. And so, but at the same time, we have to carefully balance that with a thorough look at, what are the existing policies? How do they apply to these issues that inmates may be concerned about? And so a few weeks ago in that special report that I did on New Lisbon, it really focused on, okay, what are the concerns that inmates have? Mm-hmm. What are the safety concerns they may have? Also, what are the fears simply associated with being incarcerated in a prison facility during a time like a pandemic? I think it's pretty clear nationwide that prison facilities were not made to, contain infectious disease outbreaks. That's just by the very nature of the institution. It's very difficult to manage a pandemic. And so I think really focusing on what are the experiences of the people who are inside this facility? What do they say about how these protocols are being followed? And so that was really a focus with that. I was going to touch a little bit on the jail side of things, but I think right now we're focusing on that state prison system. Yeah. But I think there's a bit of overlap in both, and how that, making sure we're amplifying the voices of inmates inside those facilities.
Okay, thank you. So Aaron Hicks, if you can, and we got it because, so I'm just gonna put it out there because the time is gonna go by like that, right? So, at 1 o'clock we will be done today. So, Aaron, if you can kind of give me a snapshot, if you could just kind of tell us more about yourself and also your relationship with the criminal justice system, and then so we can get to everyone else, and then kind of go from there. And then I got a slew of questions I want to be able to ask and put out there.
Absolutely.
Thank you, sir.
So I would just I did 2 terms in prison. The first was like a 22-month stay. The second was a 12, close to 13-year stay in prison. And after that, I went on to get out of prison, get some more education, finally get off of extended supervision, and actually work with the population of people that I was affiliated with, and started to try to see where can I, turn my mess into my message. And so that's kind of what I did. And so it has allowed me to work with a lot of people coming home from prison as well as jail, and also be in just close contact of how they're doing, what type of aid they're being provided. And I think what's difficult for me is being able to distinguish between what our secretary has said and also echo again by, I really want to get your name right. So can you tell us all one more time, please?
Magda Fasahaya.
Magda. And she kind of also echoed some of the things that he said. But talking with individuals that are currently incarcerated and who are living in this pandemic, it's hard to distinguish because from their lens, they're not getting the very things in which they're talking about, the cleaning up. As a matter of fact, a lot of what I've heard, again, this is third party, and it's always having to distinguish, but people are not wearing masks, and it's not as clean as they would want us to believe. And so again, like I said, it's very difficult to distinguish between the two based on my experience in being in incarceration and just learning some of the things I've learned. I do believe that it has been a level of transparency that has not been displayed. And so again, is how do you actually get through or get some clarity on what's taking place and why are these things taking place? We understand that clearly these men and women are not leaving out of the prison or the jail unless they're in minimum custody with, being able to work and so on. But in our, higher security institutions, we know that they're not leaving. And so for this to be running rampant inside of our prison system, it makes you question a lot of things.
Mm-hmm.
And that's just based on the evidence. It's not based on, second or third party. It's strictly just based on the evidence alone. It's showing that something is taking place that shouldn't be. And how do we get to the core of it so that based on their mission statement is to make sure that they protect the community, but they also said that in their mission statement that it's also to protect the individuals under their care. And so how do we get it to be balanced out so that those individuals are being protected as well, despite their position? And so I'll just stop right there.
Thank you so much, Aaron. I want to go over to Emily. Thank you again for being here, Emily. I'm posing the same question to you. You can tell us more about yourself and describe your relationship with the criminal justice system.
Hi, yeah, I'm Emily Hamer. I'm a reporter with the Wisconsin State Journal. I've been reporting on the correction system for the past year or so, and on what's been going on with the pandemic as well. I have been reporting on the deaths and the outbreaks, but also have been just hearing lots from inmates as well, and some things that I haven't necessarily reported on, but just lots of concerns that I have been hearing from people inside the correction system. They sort of similar to what Aaron was talking about, they have said that there's on and off in different prisons. I can't speak to every single prison, but several inmates have complained about like inconsistent mask usage, inmates mixing together during work and while they're doing recreational activities, on top of it just being a very crowded environment, and which DOC doesn't really have control over that. It's just such a crowded situation. It's hard to prevent spread inside that setting once it gets in there. And I've heard about some inmates hiding their symptoms. There have also been just reports about the guards being overworked. I've talked with some guards and staff members as well about how they're just being overworked and how they work even when they're sometimes exposed to COVID-19, and they're just, the inmates, it's sort of this feeling of being scared and frustrated, and some of them feel like the staff just don't care about them. One inmate told me that his quote was, "Our lives don't matter." Another guy who got infected with COVID-19 at Kettle Moraine Correctional Institution said that it's a joke how they've handled it. That was his quote, and he felt exhausted and nausea, and he couldn't taste anything. And then, of course, there are the 19 inmates who have died. So I think it just is really hard for the people who are inside. And whenever I talk with the Department of Corrections, I've spoken with MACTA before, and I talk with their spokesperson a lot. It does seem like they are really taking it seriously and trying to do whatever they can or whatever they possibly can, but it just, I don't know if it's an impossible task to prevent it from getting in there, but it also seems like even if the higher ups at the Department of Corrections really are doing everything in their power, that that doesn't always translate down to like an individual warden at a specific prison or the staff members there. The guards and inmates that I've talked to said that some of the, just like we're seeing here on the outside, where not everybody is taking the pandemic seriously, that happens on the inside too. There are guards who don't want to wear masks. There are inmates who don't want to wear masks. One instance in Kettle Moraine Correctional Institution, an inmate told me that there have been like a dozen or more memos about coming from the Department of Corrections about precautions that should be taken. And one of them was not being followed. They were still sitting next to each other when they were eating at a table. And he brought it up with his complex sergeant, and the sergeant, he said, quote, he laughed it off and said that there have been so many memos lately that he doesn't even read them anymore. This place has a habit of putting one thing on paper in memos and then doing another. So it seems like even if the Department of Corrections has the best intentions, there may be a disconnect. I can't speak for every single prison, but that is just some of what I've been hearing.
Thank you so much, Emily, for sharing. I want to go over to Jerome and then over to Rebecca afterwards, if you don't mind, just kind of sharing with us as far as tell us more about yourself, your connection with your relationship with the criminal justice system, and your take, please. Thank you.
Okay. Well, thank you for the invitation of being here, Coop. My name is Jerome Dillard. I am the State Director of Ex-Incarcerated People Organizing, also known as EXPO. I've been around the criminal justice system for a while. I'm a directly impacted person who served time in Wisconsin State Prison. I've also had the opportunity of working in a correctional facility that's ran by DHS, the Wisconsin Resource Center. I commuted there for 2 years, working with staff, and my position was a peer support specialist there, working with the population. I've had opportunity of also being the Dane County Jail Reentry Coordinator, which I held that position prior to taking the position I'm currently in. I want to say that, what I've learned over the years, even when they were creating Bridges to Success, one of my questions to the then Reentry Director was how, this is a lot, how is it going to be rolled out? And I was told that, well, each institution will roll it out as they see fit, or what the needs are. And I feel that that's a pattern that's going on still today, that each institution is its own city, and there are different things going on in these institutions that maybe East Washington is not aware of. But they are their own cities that I know, and sometimes there's a lack of uniformity within this system. I'm gonna keep it short, so I'm Jerome, and a directly impacted person, and I'd like to come back with the question.
Thank you. And Rebecca, if you can go next, please, and just tell us more about yourself and describe your relationship with the criminal justice system.
Hi, good afternoon. Thank you for having me. I'm currently the housing coordinator for Nehemiah within the reentry services. And outside of Nehemiah, I also, for the past 10 years, have been known as Boss Lady on the radio station, 89.9 FM WRT. So I've been connected with the incarcerated population directly for over 10 years, in addition to the job I hold on my day-to-day. Together, we have seen tragedies. We've seen, we went through 9/11, we went through Hurricane Katrina, we went through losses, celebrations, birthdays, deaths, everything, you name it. The fact of the matter is that the incarcerated community is actually our community. And it's not a separate entity when you really think about it. So what I want to give you real quick here is a couple sentences and paragraphs that were written into me from those gentlemen, just like Naomi said, that need their voices amplified. And real quick before I say that, several of you have mentioned that the actual population right now is 20,423, And that is great that it did go down. However, the design capacity of our facilities is only 17,635. So if you take away COVID completely, we are still over capacity by 2,788 people. Not only are we talking about trying to reduce the population because of a pandemic, but we are over capacity for human rights, ethics, and dignity. A few sentences that were written into me. One person said, "My cell hall has not showered since last Friday. This is so unsanitary and nasty. How can we keep ourselves clean when we are not permitted to shower regularly?" Another one said, "It's a constant struggle to remain in good spirits when your predicament or living situation is being subjected to the things we face head on a daily basis." Another says, this is Waupun, it says, "Working 12 plus hours in the kitchen because of lack of staff, starting at 4 or 5 in the morning, ending at 5 or 6 p.m. And if you refuse, you get put in segregation." Sidestep note, United Nations determines that 22 hours in segregation without meaningful human contact is considered torture. Also, anything over 15 days in solitary confinement is also considered torture, especially if there's no defined end date to that. Another person said showers and phones are every 3 days. Another person said staff is passing out and collecting the trays. There was one facility also that staff was working with COVID. So if you imagine that a staff member that is infected with COVID is going to every cell, passing out and picking up the trays of their food that they're consuming, it's a concern. This person said that they were quarantined for surgery. Staff added a new person in who was exposed to COVID without checking the file the day before his surgery. He had to restart his quarantine, and it took over 2 months before he could get his surgery because of the quarantine and lack of checking files and where they're putting people. There's another one that it addresses the shutdown of a cell hall is potential talk at Waupun. So this gentleman says that, they're shipping over 200 people out of the institution. Mind you, as I said with numbers earlier, that with how we are over capacity, there's only 120 openings. Mm-hmm. So even if you move 200 people, we're still over capacity. Transitioning and moving people around isn't the answer. We need them out. This person says that they're shipping people out and my brother is leaving. He said, "I seriously feel as though I'm losing the one and only person who I have here at Waupun. He's been my friend for a long time, and trust me, friend is not a word I throw around too loosely. Of course, we'll keep in touch, but it definitely won't be the same without him." These are gentlemen that have spent 30 plus years together. Another one, I have 2 more. "I was tested positive and was given Mucinex, and that was it. My heart was hurting, and I felt like if I was straining for it to work properly. I am almost 40, so I thought it was a heart attack. The feelings would occur late at night, so I would have to self-soothe. But now I'm having problems sleeping at night. As far as my contact with the outside world, I have lost most of it. I am currently serving life without parole or extended supervision. I don't have any blood relatives in here, and that means I'm pretty much going through this on my own. I don't think my story is unique, but it still needs to be heard. God bless." Another person says, "We are spending 23 hours in our cell with 1 hour out every day." And one last one I do want to touch on. This one, just to reiterate, I know a lot of people think of the COVID system in the prisons as you do the crime, you do the time type of thing. And it's really important that I read this last message. It says, "I was given a 16-year sentence for taking undercover agents to buy $2,300 worth of cocaine. I am in no way making this statement with intention of minimizing my wrongdoing. I make this statement hoping to bring awareness of the fact that sentencing guidelines urgently need to be put in place. I was also denied an ERP program and denied the drug program. This is my first time in prison, 16 years. I have taken many classes, programs, and groups that the Department of Corrections has, and I've taken so many they won't let me sign up for anything else. I've graduated from 2 technical colleges with 3 diplomas, 3.09 GPA, and most recently, this time last year, a 4.0 from Madison College, where I was able to shake Kevin Carr's hand. I've completed a semester towards my associate's degree in liberal arts, on the dean's list for academic excellence. I worked my way to a work release center and I'm now on community custody. I suffer from 3 different respiratory issues that put me at high risk. I clawed my way through an extremely harsh sentence in which I suffered traumatic losses such as the death of both of my parents, only to find myself still serving a heinous sentence and now staring down the barrel of a possible death sentence. I definitely don't deserve the mental anguish of sitting in the cell wondering every day if I'm going to die in prison for 2 ounces of cocaine that wasn't even mine. I've already served almost 8 years. Please help. So to sum up some of the problems that we've heard here: lack of staff, overworked staff, PTSD for staff. They're already working with a frustrated population. Lack of access to healthcare, although you mentioned that there is healthcare, they're being denied their medications because of the brand that they are. There's also been no aid for mental health concerns. Some of the communications have been blocked as far as emails that people are trying to send out to let us know what the conditions are really like inside. They do try to express that, and then they don't allow those to go through. Numbers reported are not matching what's going on inside. I know that last week, Fox Lake had said we had 3 deaths, but they're not being reported as COVID. However, Kevin, you did increase the number from 16 to 19, so that may reflect those differences. Officers are not actually using the proper PPE, even though the memo states that they should be. This also goes for when they're searching cells, not just regular interaction, but they go in, search everything, touch everyone's belongings, and then tell them to go back in to their cell, but will not provide them with bleach or anything to clean up what's been touched. So lack of proper HVAC, ventilation, and sanitary conditions. No set standards, as everyone else had said. I think, Jerome, you had mentioned too, facilities are reporting that they're under different guidelines and they're choosing what and which guidelines they want to follow. We aren't doing any better than any other states. We're at the top of the list for racial disparities, even without COVID. Wisconsin has one of the highest Black male incarceration rates in the nation. And right now, because we are so overcrowded, transfers are not the answer. We're just shuffling. We're just moving people into an already overcrowded facility. You have community corrections individuals that have 1 foot in the community with no fencing, and they can have recommendations to have sentence modifications and be removed. And that is an entirely facility that we could move elderly and the infirmed. So thank you for giving me the opportunity to share their voices. They wanted those things read, so I appreciate it.
No problem. So one of the things, and this is more of a question to Kevin, and I'm sorry, Secretary Carr and Makta, sorry about that. I think, so I guess there's a couple things that was going on here. We hear as far as all the different things that are going on. We're hearing from people who are saying things that are in the chat that their loved ones are incarcerated right now, and also talking about what's going on. We hear about the letters that what Rebecca had basically read. Just trying to just think about, like, how are you all being able to keep track of what is going on? I mean, we understand that people are reporting out to you, but what's I mean, because you have to start thinking there's some uniform way that things are falling off track. There's no way, I mean, absolutely no way that you all, definitely, you don't know everything that was going on in there. So who's actually reporting this stuff out to you all? So then, and then also who's also following up to kind of see, all right, people are wearing their masks. People are, I'm not even talking about the inmates, I'm talking about the individuals who are working for Department of Corrections, are wearing their masks, are providing bleach, are providing, because, we see it, we hear about it all the time. I mean, there's individuals who live up north that may say, hey, you know what, it's okay for me not to wear my mask. You know what, if he catches it because of me, so what? And then also being able to talk about not having appropriate staff and things of that nature. What are you all actually doing about that? Because I mean, I'm pretty sure these are already some concerns that come up. So yeah, if you can kind of speak on it, please.
Sure, I think we're going to tag team you on this one.
Yeah, that's fine.
Okay, because I will have a couple of initial responses, and I'm sure Makta will fill in the gaps on anything that I leave out. But first of all, as it relates to staff not wearing masks, we utilized our existing disciplinary process to deal with that issue. When, it is observed and we have, evidence that a person is not following the directive to wear a mask, the first time that it happens, they're given a warning. And then a second offense would result in formal discipline ensuing should that case be proven. Because these folks have rights, just like anybody else, to due process. But when those issues are identified, I'm confident that my senior leadership at the institution level is dealing with it. Now, that doesn't mean that, the observations that are being reported to, some of you folks aren't accurate. It means that, we have to do a better job of reinforcing the requirement for people to wear masks and to ensure that the supervisors are appropriately dealing with those issues when they come up. Up to this point, I believe that they have. And the reason I believe that they have, and this goes back to how do we know what's going on, is if I describe to you the structure of our agency, just very briefly. It's me at the top. I've got a deputy secretary. I've got an assistant deputy, and then I've got Magda, who runs DAI. Then she's got 2 deputies under her, or assistant administrators. Okay, and then we have wardens that run each facility or superintendent. I have to have a certain level of trust in Magda and her 2 administrators who have all of the facilities divided up between the 2 of them, those assistant administrators, to stay on top of what is actually happening in those institutions and then report that whatever is going on back up the chain of command through Magda to me. Mm-hmm. And there was a good reason that I selected Magda for this position when I was appointed, was because I felt it was important to have a person of color and a woman who I trust, who is very capable to oversee that operation, and who was in alignment with me and the philosophies that I wanted to bring for change in this organization. So, when I ask Magda if this is happening or that is happening, and she looks into it and she comes back and tells me what the facts are, I believe her. That's how I know what's going on. Magda?
Yeah, thank you, Secretary. And so what I'd like to add is we have regular meetings with leadership at the institutions. We are meeting with them on a very regular basis, not only with the wardens, but our security directors, our deputy wardens, our HR directors, our budget directors, and there is always new direction as a result of this pandemic, as we're trying to keep up with the ever-changing nature of the pandemic. When we are aware of a situation, we do address it. I want to be very clear. Masks are mandated for all of our staff and persons in our care when they're outside of their cells. We have, in fact, addressed and in a disciplinary way, supervisors that we found were not in compliance with the mask mandate. So this is something we take very seriously. I also want to address the issue about staff coming into the institutions that are positive. Staff are not permitted to come into the institutions when they are known to be positive. We have a screening every single day when they come into the facility, just as you see at other places, they get their temperatures tested. We are testing them on a regular basis. Just a couple weeks ago, we started testing our staff every 2 weeks so that we can make sure that we have a regular understanding of what the pandemic looks like in the institutions. But as you know, the nature of the pandemic is that individuals may be asymptomatic and not know that they are COVID positive or have been exposed to COVID, and that could, end up spreading in an institution. But that's not because it's they are knowingly spreading COVID-19 in the institutions, because that is not permitted. And if that were to happen, we would again be addressing that, as that is a serious offense in my eyes and in the secretary's eyes. So we are again getting regular updates. We have an emergency operations center that has been functioning since early March, that also addresses a lot of the issues and researches a lot of the concerns as it relates to the pandemic and how we need to navigate the pandemic. This is something that we have been working on, like I said, since March. Every single day, probably 7 days a week, this pandemic has been a priority for this agency. So again, just like it is in the community, without a cure, this is a difficult pandemic to manage, but we are working with the tools that we have, with the resources that we have. And to address Rebecca's comments about the overcapacity of the institutions, we are aware of the population issues. That is why we have taken steps in these last 2 years to exhaust every type of release mechanism available to us. And we've been successful in reducing the population by 3,000. That's just in 2 years' time. Imagine what we could do for many more years to come, because the population didn't increase in the last 2 years, nor did it increase in overnight. And so we have been trying to address the population as best as we can. But of course, there's more that can be done that we do not have control over. The legislature does. So just something to think about as we move forward in this conversation. Thank you.
It's something I also, because I think it's great that you all are doing testing, but I'm just thinking about, like, so in Madison, I know at the university, they're doing daily tests, or they are 24-hour tests that you can get, right? Or you basically know your results within the next 30 minutes or whatever. So I'm thinking, is it a way for you all to be able to get those types of tests that where within the first 30 minutes or so? I mean, because even 2 weeks, that's not enough time, that person can come in and affect the whole population that's there and the people who they come in contact with. And again, I think it's very clear, there's such a huge disconnect, right? Even I'm thinking of Shannon Ross, a young man who just was recently got out of prison. It was also the exact same type of thing. And he's noticing, like, hey, look, I know they're not wearing their masks, they're not doing this, people are wearing them underneath their necks, but there's that officer or is still there, the guard is still there. And so just being able to make sure that there has to be some type of way of how the communication needs to be addressed on a regular basis. And maybe at some point, the way I look at it, if you all are not, I'm pretty sure you may have a Zoom meeting or whatever. If you're not comfortable actually walking through the institution, that means that some more stuff needs to happen, right? How often, I guess, let me take that back a little bit. How often are you all actually going to the institutions yourself to actually have a meeting, or is it being done by Zoom? Because I just think it's a different type of, when I know something's secure, I feel comfortable going, right? And so I'm just thinking, even for you all at this point, or even later, do you feel like it may be that you can, if there was regular testing, like real regular testing every day before someone's shift or whatever, at that point, do you feel like you'll feel more comfortable actually going into an institution?
Go ahead, Secretary.
Pardon?
Go ahead. I was going to speak, but go ahead.
Please go after. Please back me up. But I just want to talk about testing for a moment. I'm looking at a chart that indicates the amount of total tests that we have done at DOC. Now, this is probably a little bit dated, but I'm looking at our prison population at around 20,500 on this chart. It's on our website, so feel free to go there and take a look at it. Okay, and we've done about 73,000 tests of the people in our care since the pandemic began. Minnesota, for instance, has done 72,000, but their population is 7,400 people. I wish ours was, okay? We can have an hour-long discussion about the difference between us and Minnesota and how many times publicly I have stated I'd like to move towards a model that is very similar to what they do up there, okay? But you look at Illinois, they got 30,000 people in custody. They've only done 22,000 tests. Indiana's got 24,000 people in custody. They've only done 11,000 tests. We've done 74,000 tests, okay? Now, granted, if even when you look at the number of in custody deaths, I think Indiana, for instance, that's got 24,000 people in custody and did 11,000 tests, they had 37 deaths. Maybe there's some correlation there. I don't know if it is or isn't. We are testing as we have advocated, and we're pushing for aggressive testing from the National Guard. And I'm just saying this now, and this is a little bit of news, and Mark is going to say, oh, you shouldn't have said that, okay? But we're exploring the use of rapid tests now.
Okay.
So that we can do a more robust testing effort in order to quickly identify folks in conjunction with the new guidelines that were put out from the CDC about quarantine and isolation last week, where they reduced it from 14 days down to 10 with no test and 7 days if you have a test. We're looking at how we can integrate those new quarantine and isolation recommendations from the CDC along with the potential of using rapid testing to better identify positives quicker. Mm-hmm. Last thing that I'll say about that is, as Magda mentioned, we do outbreak testing, we do a scheduled testing, we do testing of everybody that's coming in the door at Dodge, and then we test people before they get transferred from Dodge to other institutions and interinstitutional transfers. We're trying to do as much testing as we have the capacity to do in order to identify positive cases and manage those cases effectively. And in that effort, we are just recently started testing all of our DAI staff every 2 weeks. You know, do I wish I could test everybody every day? Absolutely. But that's not in our capabilities right now.
Thank you.
Hold on.
I was just in there, man.
Oh, yeah.
Thank
you, Secretary Carr.
May I ask just a quick question? Because I was looking, you said always go to your website, so that's kind of where I've been getting my information from. I'm just kind of curious, like, because these individuals are not being able to get they're not getting any contact visits, and a lot of them are, I mean, they are going through a lot of quarantines where shut down whole units, they're not able to get rec as usual. My question is, what are you doing as far as their mental health, and how is that being helped? Because I noticed also that the staff, it's a decrease in your staffing. So I'm just kind of curious, how are these individuals, their mental health and their psyche being taken care of?
Okay, I'll answer that question quickly because we're already at 1 o'clock. This is a lunch and learn, and I'm sure
Yeah.
a lot of folks got to go back to work or do whatever they got to do.
Right.
I actually, Secretary Carr, I actually got permission to ask for permission to go about 5 minutes over. So
Okay. Well, all right. Well, then, all right. To answer your question as quickly as I can, you know, during this pandemic, a number of staff in and DOC were allowed to work from home. Okay. We made a very deliberate decision not to allow our mental health staff and our social workers who deal with our folks on a daily basis to work from home, because we felt it was important for them to be available to provide those types of services to the folks that are in our care. So that's one. Two, when our administration came into office, our vacancy rate exceeded 17.5%. I just got a report. I get one every other Tuesday about our vacancy rates, and our vacancy rates overall, and that includes all categories of individuals. And I know that we have some specific issues regarding recruitment of certain positions in the organization, but our latest vacancy rate was around 14.9%. So, you know, it's not great, but it's certainly better than when we came in. And I'll be honest with you, I thought for sure that when the pandemic took hold and the unemployment rate went higher than anyone expected, that would provide opportunities for folks to look for state jobs with benefits, retirement, and that would positively impact our vacancy rate. That didn't happen to the extent that I thought it would. Do we have a lot of work to do as far as recruitment goes and getting more people in the door in every type of category, whether it's correctional officer, security, or whether it's social workers and mental health? Absolutely. But I'm certain that every one of you know that there is a shortage of mental health professionals throughout the state, even in the private sector. That is something that our state is grappling with as a general issue overall, least of all, and not surprisingly, in corrections as well. But we are going to use telehealth and technology to try to expand the access to resources throughout the state, whether it's for folks that are in our care or folks that are on supervision in DCC.
Okay.
And those are some of the budget initiatives that we have requested in the upcoming budget to increase our technological capabilities so that we can reach more people and provide more mental health services in the future.
That's good to know, Secretary Carr. I know we're coming to time here. Oh, I believe
Jerome's got one last question.
Yeah.
Okay. Well, Secretary Carr, I've been hearing the numbers of how we've decreased the population. I'm just curious, how many actual people were released from the Department of Corrections this year or since the pandemic? Because I know that revocations have came to a halt during this pandemic, and the numbers kind of missed there, but is there any way that you can give us that number?
You know, I would leave it to you to ask the one question that I don't have the answer to. I mean, but I certainly, you know, I mean, I don't want to guess, but I can tell you that, you know, we have reduced our population by 3,000 people. So that's the number of people that have been released. Okay.
I can provide, these numbers are a little bit outdated. So we will undoubtedly have an increase in these numbers, but I can give you some numbers that I actually put together, I think when I was talking to either Naomi or Emily during one of our interviews. So just October 19th is, unfortunately, I apologize that these numbers are so outdated, but we can get additional numbers to you, Mr. Dillard. As of October 19th, we had released over 1,700 individuals through the earned release program. As I had indicated earlier, that is one of the programs that we are continuing because of its impact onto our population and trying to get as many people out released as possible. That number has since increased, so we will get that information to you. As of November 2nd, and if you are familiar with our release mechanisms, the Secretary has the ability to allow early release for nonviolent persons in our care in accordance to statute who are within 12 months of release within the confinement portion of a bifurcated sentence imposed between 2009 and 2011. And as of last month, he had released 22 individuals in 2020. And this is a very small and narrow group of individuals that the Secretary is able to release because of these statutory requirements. But if I'm not mistaken, and Secretary, you can correct me, you are exerting your power with this, and this has not happened in 8 years prior. I don't believe previous administrations exerted their authority under this particular statute to release individuals. So the Secretary has been using his statutory authority to release individuals. And like I said, that number was from November 2nd, so it is delayed. And then as of October 31st, we have been pushing and trying to work with persons in our care to apply for compassionate release through either extraordinary health care releases or geriatric releases. Unfortunately, all we can do as an agency is recommend individuals for release to the courts. The courts then have a final say on who can be released and whose sentences that they can modify. And as of October 31st, again, I apologize for the outdated numbers, 12 people had been released. And that's not for the lack of the department's role in trying to educate people and try to work with them on the applications. And then finally, we've been working with Milwaukee County, and we've been working with the district attorney. We've been working with Milwaukee County judges, with the public defender's office and other organizations to try to work together to get individuals unilaterally released by the judges so that they can modify their sentences unilaterally. As of last month, 22 individuals have been released as a result of those efforts. And so I just want to reiterate, this is not for lack of trying. This is not for us, not exhausting our options and our abilities. In fact, we've tried to go outside of the box and really try to work with different stakeholders to get people released. But these numbers, I think, are a testament to the work that we have been doing, in addition to the individuals that are no longer being incarcerated due to revocation and the other ways that we've been trying to work to decrease the number of persons in our care in the population.
Right. I would just add, and I hate to, to make us go longer than we really are scheduled for, because I'm sure we all have other things to do. But when Magda talked about the earned release program, it's important to know that we are expanding the earned release program in a way that previously you had to be in a minimum security facility in order to be or classified as minimum to participate in the earned release program. We've changed that so that the earned release program is being offered in all of our medium security facilities. We're expanding it in that direction. We hope that our expansion and increasing the eligibility from 36 months left in your sentence to 48 months is going to result in an extra 1,000 people a year getting out on the earned release program. And so we're looking to expand that. The other thing that you should be aware of, in case you didn't hear or participate in our revocation town hall meeting, we're making changes to how we deal with revocations in the Division of Community Corrections in a way that we hope is going to have a significant reduction in the number of revocations and how we deal with people serving ATRs. Like, for instance, an ATR as an alternative to revocation. In Milwaukee, for instance, where we used to conduct all of those ATRs in the Milwaukee Secure Detention Facility, we've discontinued that, and we believe that we can better address those ATRs out in the community using community-based programs, as opposed to having people locked up to do those types of ATRs. We're also changing some of the ways that holds get placed, where we don't, through our electronic monitoring center, when somebody gets stopped in the middle of the night by police, there's going to be a different view and matrix that's going to be used to establish whether a person gets a hold put on them. You know, because of the disruption that causes to people's lives if they have a job or they have kids or they have a job, you know, I mean, a job, a house, kids, whatever. Okay. It's really disruptive. We're changing it in a way so that if what conduct is being reported to us is a danger to public safety, then obviously a hold is going to be necessary. But we're really taking a good look at all of that stuff. And I think all of that stuff is going to result in lower population in the long run and a fairer, better response to the folks that are on supervision and the people in our care.
Thank you. Well, first I want to say, first I want to go ahead and say thanking everyone for being here. Thank you for all the work that you guys are doing and the things that you have changed. But then also I want to, at the same time, I do want to say there's a lot more work that needs to be done, right? So, yes, sir. So, just want to, again, just say we appreciate you, appreciate the both of you and everyone that participated today. I do want to say we are having another lunch and learn that will be coming up soon. We'll be sending out information about that, talking about the sex offender registry, as well as we are going to be having some more conversations on the Black Like Me podcast. To be able to really, really kind of do even more deep dive with more time about our conversation today. Again, I thank you everyone for who had joined us today and looking forward to having more conversations with the community. You have a blessed day.
Yeah, thank you so much.
Thank you, everyone.
Thank you all
very much, everyone. Happy holidays and wear a mask.
Yes, sir. Yeah, happy holidays.
Yep.
I think that is basically it.